Today's guest is Jeff Dismukes with the Department of Mental Health and Substance Abuse Services. You're no stranger to the people who watch our Wednesday night stream.
Right.
On News 9, News on 6. We talk behavioral health every other week. Good to have you here.
Hey, it's nice to be here.
A lot of people signed up for office this week.
Right.
You've been at the department for a very long time. You understand stigma. You understand the advances that have been happening in Oklahoma. So that's going to be a campaign issue for a lot of folks. How are we doing on behavioral health in Oklahoma?
Actually, we're doing fairly well with behavioral health in Oklahoma. We're one of the leaders in the nation in several different areas with what we're doing, but we're also have some really innovative programs that are coming into play right now. You have mobile crisis across the state. We have a third-party transport system now, so people don't have to be transported in the back of a police car when they need behavioral health services. We're expanding crisis centers, urgent care centers, to really be able to address the needs of people when they are in need in their communities. But also we have 988 coming, and what 988 is a 3-digit hotline that you can dial when you're in crisis or even before you're in crisis and actually be able to talk to somebody and get linked to immediate services. And that's what's going to be so unique about this. This call line is going to be able to actually make appointments for people next day. If we have to, we can get people out to the home to care for them. We are going in the right direction here for behavioral health.
Okay, I saw you in the paper the other day talking about Griffin Hospital.
Right.
Man, it's just like stepping back in time. You understand the progress that we've made. You know, in Oklahoma County, the voters are going to be talking about in June about whether to fund a bond to build a new facility. Right. Can that old facility be rehabbed to do proper behavioral health treatment? Well,
no, and remember also that that's not the best place to be doing treatment for mental health.
Okay, so with the answer being no, and virtually everybody we've talked to is saying no, then people got to decide whether or not they need a new facility, right?
Right.
So what should voters, when they think about behavioral health advances we've made in Oklahoma, what should they be thinking about as they go to the polls in June to decide on the future of a new facility?
Well, as far as from a behavioral health perspective, there is a need for people who are in jail to be able to receive treatment. Now, there's also a need to be able to divert people who are appropriate to divert out of that system and get them into a treatment facility. But when they are there, they need to be able to have proper facilities so that we can do assessments in jail, so that we are able to provide treatment and keep people on treatment needs that they have. There are many things that come into play there. And just also for treatment, general overall health treatment that's necessary for people there.
All right, so that's a big decision for them as we get closer to the election. We'll talk more about that. Since you've been at the Department of Mental Health, how long have you been there?
I've been there almost 20 years now.
Okay, so how far have we come, in your opinion, in Oklahoma, from where it was the day you went to work there to where we're at in terms of understanding, accepting the situation, and moving forward with treating behavioral health in a way that's effective?
Well, it's light years from when I came into the system. Well, number one, we're talking about behavioral health issues all the time now. This is something that's a topic in the news. We talk about from a workforce perspective. We've been talking about with criminal justice. That wasn't happening then. But there are new treatment options, very successful treatment options that have been brought into play. And the department's really been leading the charge on all of that. You know, I will say, though, that we still have a long ways to go. There are still issues with parity issues, the stigma issue. There are many things that we can do.
Jeff Dismukes, you're a good man. You've been there for a long time and you're watching the progress. Thanks for helping us understand.
Well, thanks for having us.
You can see him every other week on the Mitchell Talks News 9 News on 6 stream, and hope you'll tune in sometime. See this again at news9.com/yourvotecounts, and follow me on Twitter @Mitchell Talks.